I'm pleased to introduce Brenda Tully to ground us in the topic we will be discussing.
Thank you, Taylor. Hi, my name is Brenda Tully. I am a researcher with the UCLA Pritzker Center, and I am here to share with you findings, very preliminary findings from a project that is in progress that we are doing. It is called the Collaborative Reform and Child Welfare for Families Experiencing Domestic Violence in the Antelope Valley. So this project is based on previous research that we have done that was funded by the Blue Shield Foundation of California and Van Nuys Charities, which has funded the current project, both of which have funded the current project as well. And our previous work produced an initial report on child welfare and domestic violence, a national summit, Zoom series, and other trainings. And that report is available on our website. So this led to our current project. Next slide, please. Our current is based in the Antelope Valley, and that is for several reasons. There are opportunities in the Antelope Valley to enhance child and family and community wellness through service coordination and ideally service expansion. And we are engaged in partnerships with DCFS. DCFS requested that we work in the Antelope Valley after an analysis showed that the area is where DV and child welfare intersect the most in LA County. And then in addition, Valley Oasis, which is a DV services agency, was a willing partner. And so that grounds our work for this current project in the Antelope Valley. So the project involves developing a collaboration between DCFS Lancaster and Valley Oasis to more effectively serve families experiencing DV and child welfare investigation in the Antelope Valley. As with all of our work, this project is highly collaborative, and it explores domestic violence and child welfare through an intersectional lens, considering participants' identities, race, ethnicity, previous foster system and DV experiences, as well as others. And today I'll focus primarily on the findings related to intergenerational trauma and mental health. Next slide, please. The project is fueled by our implementation team, which holds our partners and us together in as the kind of engine behind the collaboration. We meet monthly to provide project updates and coordination, and members meet in between meetings to coordinate the various objectives of the project. Through the implementation team, we presented preliminary findings, and then Valley Oasis and DCFS staff coordinated to determine what interventions the project would then begin. So the aims of the partnership for DCFS Lancaster were broad. We wanted to kind of enter the space broadly, and we are primarily focusing on increasing DV-related knowledge, and I'll talk a little bit more about that later, and increasing the number of survivors who are connected to DV services. And then the aims of partnership for Valley Oasis are to increase knowledge of the child welfare system so that they can enhance services to families involved in DCFS. And this really is about strengthening their position of advocacy along with families as families kind of navigate the DCFS system. So we started the project by hosting an information session in the Antelope Valley. And we invited Valley Oasis staff and parents who were engaged with Valley Oasis services. And the purpose was to familiarize both groups with our research staff, what the project goals were, and to discuss a plan for data collection. We wanted the parents to be informed ahead of time so that they would know kind of what to expect if they opted to participate in focus groups and interviews with us. So the first piece of the project after the information session was our preliminary data collection. We did focus groups and interviews with DCFS staff, Valley Oasis staff, and then also with parents who were served by Valley Oasis and experiencing a DCFS investigation. The purpose of the data collection was to better understand DV services in the Antelope Valley and DCFS service coordination. We wanted to elicit recommendations for service improvement from different perspectives and also use this information to inform how DCFS and Value ACES would collaborate throughout the rest of the project. So today, as I mentioned, we are focusing on our preliminary findings from these focus groups. And we met with 18 parents, 10 Value ACES staff, and 25 DCFS staff. You can see the number of focus groups and interviews that we did. The data collection took place between July and October of 2023. And you can see our attendance rates there. So our preliminary findings, we learned that survivors of domestic violence are expected to function independently to connect with services required for their DCFS case plans. And the expectation is that they will reach out to that agency and enroll and take care of, their class. A lot of parents are ambivalent about doing it. And from the parents' perspective, they talked about all of the effort they put into trying to connect with services. So this parent said, call this number. And it's like, I literally went to different people on a bus all day, going place to place. And then she heard, oh, you need to be referred to. So she couldn't just show up and access services. Instead, she actually needed a formal referral, but hadn't been given that referral. And this was representative of what many parents had shared in terms of the amount of effort that they put into trying to connect with the services that they were referred to through DCFS or that were required as part of their service plan. The findings also showed that DCFS and Value ACES staff noted obstacles to parents meeting DCFS expectations, and they primarily focused on challenging logistics. So as this DCFS staff member said, I'm telling you, you need to do this. And if they call, if their work schedule doesn't work out, if they miss their appointment, it's difficult to complete that linkage. Many times, again, because of wait lists, again, because of cell phones being shut off, or parent work schedules, or lack of transportation, or things like that. And it would be really helpful if I could submit a referral and have someone be a little more proactive in engaging a warm handoff with my parents to help connect that linkage. So here, DCFS staff were aware of the challenges that parents were having connecting with services and trying to access supports. And they hope for some sort of intermediary between the emergency response unit staff, who are the first responders, and parents, so some bridge to connect with services. So we also learned from the data that many of the parents who participated in our focus groups are dealing with the consequences of a lifetime of family violence. This includes child abuse and neglect and domestic violence when they were children, and violence from their intimate partners as adults. In one focus group, there was an exchange between two parents. The first parent reflected, domestic violence is generational. It started with our grandparents and it trickled down to our parents and trickled down to us. I always said it'll never be me. And then it was. And that's a whole nother story. And it stops now. I don't want my kids to go through this. I don't want them to experience this life. And then a second parent responded saying, I was just listening and I had tears coming down my eyes because I feel the same way. And I'm sorry. With my mom being gone now, it's been 3 years, but I'm the baby of 5. And like I said, I'm going through it. But one thing, my mom and my grandmother, they were really strong people. And I know I'm strong, but it's like behind closed doors, I just cry because I see that it's going into my older children now, definitely with my son, with this girl and the baby. So parents really shared how experiences of domestic violence were intergenerational and experiences of DCFS or child welfare intervention were intergenerational. Parents also spoke about a mismatch between their capacity immediately upon leaving an abusive situation and the expectations that they function efficiently and effectively on behalf of themselves and their children. And this next quote really shows the impact of trauma and how it interferes with parents' ability to kind of show up fully and demonstrate their ability to be effective parents. And in this situation, the parent is talking about going to court. So she said, as people who come from domestic violence, typically our abusers are like narcissistic qualities, or are just really cunning and understand our greatest weaknesses. So when you're stepping in court, sometimes you lose what the heck you're even supposed to say. It just goes out the window. And then you become emotional and erratic. And then you become exactly what the judges are looking for you not to be. And lo and behold, you lose your kids. So parents shared that the stakes are high, and they recognize that. The survivors who participated in our focus groups indicated that they and their children need opportunities to heal over the long term. And they talked about the fact that the system moves at a pace much faster than they are prepared to move, given the trauma they've experienced. So we have a couple quotes from parents who shared examples. So one parent said, clearly we're going through something. There's clearly a crisis, and it's not just going to go away because we left. Another parent shared that going through stuff that I went through and having to experience what I experienced with him, it is literally just like a stain in my mental health. I have anxiety from it now. And then finally, a parent said, you're really feeling low. My anxiety was through the roof, and I had signed up to see a therapist, and I was diagnosed with PTSD, severe anxiety, and major depression with psychosis just because of the abuse that I experienced. So we took these preliminary findings and we presented them last fall to DCFS and Valley Oasis in order to kind of lay a platform for them to decide how they wanted to move forward in their collaboration. So in response to the findings, they decided to do 2 interventions. The first was cross-system learning opportunities for staff that involved, it's coming up, but it's happening in May. It involved Valley Oasis staff preparing a very comprehensive and advanced training on DV dynamics for DCFS staff, and DCFS and partners at the Children's Law Center developing a child welfare training for Valley Oasis staff so that they could be more fully informed advocates for the parents they serve. And then the second intervention is to begin DV and child welfare consultations. So I described the cross-system learning, and that, as I mentioned, will begin in May. And the consultations, the DV consultations, have involved staff at DCFS Lancaster and Valley Oasis developing a structured role for a DV consultant available to the emergency response unit staff in the DCFS office. The DV consultant meets with the emergency response staff upon request and provides as needed individual consultations. We are currently collecting data on that work. And then DCFS is making staff available to Valley Oasis to provide individual child welfare consultations. In addition, the DV specialist is providing consultation in group settings. So they haven't joined the monthly ERDD, or eradicating racial disproportionality and disparity meetings that take place at DCFS, where they do case consultations on Black families experiencing child welfare intervention. And so the DV consultant is able to provide the DV lens in those spaces. They support attuning to DV dynamics during assessment of risk versus safety. They attend to intersectional issues in terms of the identities of the families involved in the situation being discussed. And then they also provide DV service referrals for parents and children in that space. And then our research methods have 3 components remaining. So I talked about the focus groups, and our data analysis is in progress. I mentioned the DV case consultations, and we are collecting data there. And then for the trainings, the learning opportunities, we are doing pre and post learning assessments with DCFS staff to assess what their DV knowledge was at baseline before the training and then immediately after the training. And we'll do the same regarding child welfare knowledge for Valley Oasis staff. And then we are working with DCFS to determine the possibility of administrative data for review as well. And that is the summary of our work so far. And I look forward to the panel kind of digging into working with parents whose experiences I just described. So thank you so much.
Thank you so much, Brenda. I forgot to mention that Brenda is a lead researcher with the Pritzker Center. She has 20 years of social work practice with children, youth, and families on the edge of or in the child welfare system. And she leads the UCLA Pritzker Center's research teams focused on domestic violence and child welfare and foster youth to independence housing choice vouchers in LA County. So thank you so much for sharing your insight and expertise. Next, I would like to introduce Sheedy, who will be giving us a brief overview of mandatory supporting and relevant policies. Eve was also a panelist at our last session last week for those in attendance. Eve is the founder of Sheedy Consulting, which specializes in intimate partner, domestic violence consulting, and expert witness services. She contributes to initiatives like the Prevention and Early Intervention Committee of the California Child Welfare Council and the leadership group of the LA County Mandatory Support Initiative. She has led legislative changes and received recognition from various organizations for her impactful work. Eve, the floor is yours. Thank you so much.
Good morning to everybody. Thank you for being here. If you were here last time, this is a bit of a repeat, but important for context and so forth. So what I'm going to talk about very briefly is about mandatory reporting. And I think it's important to understand contextually when you look at it versus what you just heard about the program, mandatory reporting is sort of the gateway, right, to DPS, Child Protective Services. So this is all sort of what's happening before. And it's wonderful. Thank you to the Pritzker Center and Antelope Valley for their program. And Jonathan may talk a little bit more about another ongoing program. So there's a movement. So mandatory reporting, and now that I no longer work for the government, I can say this, which is my personal opinion, but based on lots of evidence, is basically a flawed, non-evidence-based system of surveillance that does not equate to safety and perpetuates discrimination against families of color. And so the reality is, after much research was done, it's clear that our mandatory reporting system now is unfair, right? So there was this premise that if you make a mandatory report, somehow you're increasing children's safety. And that's not really being borne out. And in fact, for many children throughout the state and throughout the country, it's quite harmful. So in California, Black and Indigenous children are 3 times more likely to be reported to care, and Black children are 5 times more likely to be placed in care. In 2022, of 441,114 cases reported, 54,000 were substantiated, which is 12%. So we have a system operating at 12%. So if any of us, at our jobs, we're 12% effective, I'm quite certain that we still wouldn't have our jobs. So it's a system that was developed, I think, with good intent and certainly with the idea to protect children. But now it's time to look at it and to really ask ourselves, are we protecting children? Or are we making it harder for families to heal and to move forward and for children to thrive? So there are a number of ongoing statewide efforts and local efforts. And then I'm going to talk about a piece of legislation that we are working on. So there is this thing called the California Child Welfare Council, which is a statutory agency that's advisory and monitors statewide agencies involving children. They have, under one of their committees, they created a statewide mandatory reporting to community supporting task force. There's a couple of people on this webinar who are members of that, and they are addressing statewide changes that can be made to the reporting system to improve that system and to make it more fair. Locally in LA County, there is a mandatory support initiative. Tamara Hunter who's running that program, reported at the last session, and they are also moving forward in an effort to get people into supportive services without having to enter child protective services. And I just want to say that it's, there's a feeling that maybe making a report, in certain instances, certainly making a report could be a positive thing. But if it's not a positive thing for a family, it can be something that's damaging for a very, very long time. A report, an investigation, and so forth into families where those reports are non-substantiated and so forth, that investigation lives with that family and with those parents forever, and can impact people trying to find employment and so forth. So prior to the California Child Welfare Council actually developing this task force, there was a report by an agency, a child advocacy agency in San Francisco called Safe and Sound, that really analyzed the data and the impact of mandatory reporting in California. And I just want to read to you a quote from a woman, Jenny Perlman, who was at Safe and Sound, I believe still is. And it says the following: changes in mandatory reporting statutes are a necessary and foundational step to addressing longstanding policies and practices that target low-income and Black, Native American, and Latinx families, pushing them into the realm of child welfare. Mandatory reporting laws often result in a reliance on child welfare to respond to family need that should instead be addressed through investments in community and public systems that support a family's true needs, keeping families together and communities strong. So we all know that within domestic violence, a lot of domestic violence survivors are brought into this system because they've been victimized, right? They are brought into the system, and then they may be charged with failure to protect, and they themselves were victims. And they're brought into the system because of the concept of that they have somehow they have caused either neglect or emotional abuse by their children being exposed to domestic violence. So a group led by the California Partnership to End Domestic Violence, which is the statewide coalition, have been working on a bill, which is SB 1126, which has just passed the Senate Public Safety Committee and is now going to the Senate floor. And I want to explain what that bill does and hopefully request your support of the bill. So SB 1126 is a clarification, because if you provide domestic violence services or mental health services or other kind of supportive services, oftentimes either A, you have to begin your relationship by explaining to someone that if they say the wrong thing, you're going to have to report them to Child Protective Services, which actually can, as you can figure out, negatively impact the relationship that follows from that announcement. And it may cause people not even to seek services and so forth. And oftentimes people who provide services are not clear whether somebody's statement then requires them to report. So therefore, because there's the threat of criminal prosecution under California's law, people may be reporting, even if they're not 100% sure that they should report, but they feel really strongly that, they have to do this because the consequence of them not doing it may be harmful to them personally, right? So what SB 1126 does is it prevents, it makes it so you don't have to make a mandated report if a child is present when an incident of domestic violence occurs, or a child simply witnesses an incident of domestic violence. And so the purpose of the bill is to prevent entry into the Child Protective Service system for people who are being victimized, right? Because of the impact that even an investigation can have. And it protects people who are seeking to get help at agencies, or even by calling the police, right? without having to have the threat of entry into the system, which you've just heard descriptions of people feeling completely overwhelmed, right? So that they can seek help without having fear. So when a lot of the rules and a lot of sort of the underlying issues that support mandatory reporting is that people say, well, when children are exposed to violence, we need to do something to address that. And that's true. Okay, so there are negative impacts that can occur when a child is exposed to violence. But the question is, what is our response, right? What is our response as a society? So do we say, okay, this child has been exposed to domestic violence, which may negatively impact that child. So what do? Do we pull that child away from the non-offending parent? Do we pull that child away or somehow create a rift between that child and the parent that they have a bond with, right? The parent who's not causing harm? Or do we do what we can to really strengthen that relationship and ensure that that child remains connected to the parent who can really create resiliency in that child to counteract the impacts of children exposed to violence? So this bill is really designed to ensure that we're not causing a rift between that child and the parent who is actually the parent who can help that child heal and who has likely been working to have that child heal and be protected throughout the domestic violence, although that's not often recognized in our present systems, right? So I want to just say very briefly, there's been some opposition to this bill that sort of came up just before the bill went to public safety. And there are a couple of things that I think it's important to remember. SB 1126 does not prevent anybody from reporting a case to Child Protective Services. It just makes a situation where the report no longer is mandatory. So if someone has sought services and that relationship is moving forward, and understand, when you go to Child Protective Services, that's not a direct service agency. So they're just sending people out to get services anyway. So we're assuming for a moment somebody's already there. Okay, so we're doing what we can to strengthen that relationship and provide those resources for survivors so that they and their children can heal. So number one, it does nothing to interfere with the report. And number two, there's sort of this mantra that comes forward that people say, well, you're no longer protecting survivors of domestic violence. And nothing could be further from the truth. The people who have proposed this bill are all people who, A, want to protect children, and B, want to protect survivors. So there's not anybody engaged in any sort of underground sort of movement to try to somehow protect survivors instead of children or children instead of survivors. The idea is to strengthen services, community-based services that can help people and that we need to strengthen to make our society healthy and to thrive, right? So this concept that somehow this bill, by making this a non-mandatory report or making it so people do not have to report, is not an abandonment of survivors, because understand the context in which a mandatory report occurs is in a situation where someone has likely already sought and is receiving help. Either they're being reported by someone who is providing services already, so that survivor has already reached out, right? Or they may be reported by law enforcement, and again, they are already receiving services. So if you hear of any opposition to this bill, I ask you to really sort of analyze, what are people saying? So in order to change the system to be fair, to strengthen our community-based services that many of you on this call are involved and engaged in, and are the actual services that can can truly, truly help families be healthy and to thrive. And you'll hear from people running programs that are dedicated to just that. We really have to have the courage to change the mandatory reporting system. We have to try to find something else that enables us to provide support. This system just is not working. And I do want to say this, there has been some opposition that encourages us to wait. And in the face of a system that we know to be really, truly unfair to Black, Indigenous, and Latinx families, we cannot wait. It is not fair, moral, appropriate, or just to be able to say to someone, to a family, you know what, we really do need to change the system, but we're going to just wait and look into it some more. So I encourage you, there's some resources in the chat about how you can get more information about SB 1126. But I encourage you to engage in whatever efforts you can to really address mandatory reporting. There are too many cases that go into the Child Protective Service universe so that they themselves are swamped with cases that end up being not substantiated. And if we can really have a system that just funnels cases that need to be there and provides services and support for the rest of those cases, we will end up with a much larger of families and children who can be happy, can thrive, and can rely on the services that all of you wonderful people are providing. So I am done. Thank you very much.
Thank you so much for helping set the stage and sharing your experiences with us. I really appreciate it. I would now like to introduce the rest of our panel, who will provide their personal and professional experiences when it comes to mandated reporting within a mental health setting. So first off, we have Keith Parker, who works at Children's Institute as the director of Project Fatherhood. This is a national fatherhood program that helps to build stronger families and create better outcomes for children through work with fathers. Next, we have Jonathan M. Wicks, a clinician, musician, and tech entrepreneur. He is currently the Equity and Social Change Manager at the YWCA of San Gabriel Valley. Ajita Gupta is next. She holds a master's in social work and a bachelor's in psychology from UCLA. As the founder of Mindfield, Ajita's vision is to offer easily accessible telehealth counseling and specializing in providing compassionate support to individuals facing mental health challenges, particularly marginalized people of color. She's also a children's service administrator at DCFS. And finally, we have Jacqueline Herrera, a survivor of domestic violence, now serves as a parent partner at Los Angeles Dependency Lawyers. Drawing from her own experiences, she supports clients with open cases with DCFS, ensuring their journey through the dependency system is as smooth as possible. So thank you all so much for being here. We're really grateful to hear about your experiences and your expertise in this area. So a question for the whole panel is, would you be able to share a time that domestic violence has come up in your practice and how you've handled it, pertaining to mandatory reporting and addressing safety, both for the survivor and any children in the home?
I work for the YWCA of San Gabriel Valley. So we are a service agency, but we have a really big domestic violence program. This question brings to mind one of the cases I was on. I was providing individual counseling for a father, and even that alone sometimes can be a challenge, right? Males that come forward as, a survivor. So he already had some challenges with that, just the stigma around males being identified as a victim. But yeah, he had severe anxiety. So that was a lot of the work we were doing. And he did disclose, some information during a session about his children. He had a 5-year-old daughter and a 2-year-old son. And, it was the type of content that where I needed to at least consult the hotline. And, informed consent, I'm really big on that. So he knew I was a mandated reporter, but I did let him know, based on what you just shared, I'm going to at least have to call this in. But like I said, he was living with severe anxiety, so that caused a lot of distress for him. So we spent some time talking through how we were going to navigate this situation. So we decided to call the hotline together, had them on speakerphone. Essentially, he had concerns that the children, because he was co-parenting with his former wife, who was the aggressor and the abuser, he had concerns that maternal grandmother was molesting the children. So very serious concerns. And so when we consulted the hotline, I was really shocked at the response because the hotline, person that we were talking to essentially said, "Why are you still sending the children to mom?" And so dad replied, we have a court order. I didn't want to violate that. If I don't send them, I could be penalized for that. So I felt like I had to abide by that. And so the response was, we'll take the call, and we'll investigate, but we're also going to say that it's failure to protect on your part for still sending them to mom. So again, thinking about a person living with severe anxiety, it really put him in a worse position when he was really trying to protect his children. Essentially, they did remove the children. When he came to my office for the next session, he said they came and took my children. And then he disappeared for about 2 months. And I felt horrible because I felt like I definitely initiated that process because I was mandated to. Eventually, he came back, and thankfully, we worked together through that process until he got his children back. But I saw how my role as a mandated reporter really impacted this family when he was really trying to do the right thing and protect his children. And so I do, appreciate that DCFS is trying to move away from this failure to protect culture that's very historical with their department. And like Eve mentioned, our agency is working to train DCFS right now. So we're doing training with their hotline staff and really trying to help them better assess, is it a domestic violence situation or a child safety issue? So hopefully we continue to kind of see these changes, but that is an experience that I don't think I'll ever forget. Him coming back for that next session saying they took my kids. And again, I think that was totally related to me being a mandated reporter.
I can add to this. Domestic violence is not a siloed issue. And as a clinician, we have to really look at all these different layers that the survivor is dealing with. So frequently there's financial dependency on the partner who's involved in the intimate partner violence. I'm going to call that IPV. There's immigration issues. That's huge, especially if their visa is dependent on this partner. There are visas that legally do not allow the dependents to work. So of course, if they leave, where do they go? They might get sent back to their country, right? It might be worse over there culturally or depending on the issues there. There's language barriers, there is a lack of transportation, there's social systems, cultural expectations. So we have to really dig deep into all of these layers while we're exploring intimate partner violence issues with this person. And when the survivor finally is able to disclose that this is what's happening in our closed door sessions and in our one-on-one clinical sessions, it's very important to be non-judgmental. It's very important to create that space as open as possible. And it's our responsibility, I think, as clinicians, to give them that education, that psychoeducation, that, hey, this is how this violence is impacting your whole family, including the children, even if they're witnessing it, even if they're hearing it, this is how it's impacting it. So let's work together. Tell me how you will feel safe. Tell me what I can do to help you get to a safe environment, get your kids to a safe environment, and actually work with that survivor, empower them to make their own decisions and be respectful of their decisions, as opposed to saying, hey, you know what, if you don't do this, I'm going to call DCFS, because we're mandated reporters, we're mandated supporters now. We are not there to punish our clients. We are not there to impose any kind of restrictions or anything else on the clients that if you don't do this, because essentially we're doing exactly what the perpetrator is doing. We're taking control and authority over the survivor. And that's not very clinical. It goes against our values, right? So it's very important to work with them and then also give them the education that this is how DCFS can help. DCFS can help when it comes to immigration issues. They can help when it comes to financial dependency, giving, and there have been, in my clinical work, there have been lots of successful stories where I had to initiate a report based on what was happening in the family. And because we were able to work together with the client, bring the DCFS team member into our dynamics and link the client successfully, they were able to get out of this toxic relationship and into a safe environment. The kids were safer. And then eventually there were social support systems that came in and helped this survivor and this family. Right. So those are success stories. We don't hear them often. So I wanted to share that. But DCFS can be helpful as long as we are setting that foundation and we are making sure that our client is really the one who is making the decisions, and they're the ones who are empowered to speak up about their story.
I want to add a few more things to that. Thank you both. Keith Park with Project Fatherhood. What happens when the dad is the survivor? A lot of times our dads suffer in silence because it's not the manly thing to do to report that you're being abused. So dads will suffer in silence. And a lot of dads come to Children's Institute Project Fatherhood just to share about their experiences. What we learned fundamentally that every human being wants to be understood. Not necessarily agreed with, but at least understood, right? So giving dads that space to be able to share what they're going through and helping them understand the court system and all the things that they have to go through in order to receive the services that they deserve and that they need, right? How do we support our dads? How do we give a listening ear to what dads are talking about and making sure they have the tools that they need to be able to survive being a domestic violence survivor? And sometimes we find out when our dads come to us initially, they're reported to us through the courts to mandate to participate in the parenting program. And then through the minute orders, we find out they need to do domestic violence, they need to do counseling, they do several other things. So what we do then, we try to make sure that we support our dads, because what we find out from the work that we do with our dads, many of the perpetrators are also survivors, but they've never had a space that's been safe enough for them to really talk about what their experiences are like. And I'll share a little bit more as we go through the other questions and the work that we're doing with Project Fatherhood and our dads in the community.
Jackie, I was wondering if there's anything you'd like to add.
Hello, everybody. I am a parent partner. So for this question, when I work with our clients, we're not mandated reporters. So I pretty much, I guide the parents into how to create a safety plan, how to communicate with the social workers, how to, a lot of our parents, they're so scared to share any information that they're not compliant. So now they're like, okay, how can we find dad? So they're protecting, kind of let them know that protecting the perpetrator is not the good thing to do. So I kind of, guide them on how to address certain things. Or sometimes parents don't know how the restraining order works. And then they let, the father come around. And I'm like, this is going to become a big issue. So it's just kind of in my side, guide parents to how to deal with the case being open now with DCFS, and guiding them and helping them with the process.
Can I just add one thing? I don't provide direct service, but I've spoken to thousands and been close to hundreds of survivors of domestic violence. And I think one of the key issues is that within a domestic violence relationship, the survivor's already experiencing significant trauma. And included in that abuse is usually comments and threats by the person causing harm that no one will believe you, that if it's, you're a bad parent, if it gets reported, you're going to lose your children, and so forth. And then, as somebody stated, then the state gets involved or the government gets involved, and basically affirms all of those statements to a survivor who's already traumatized. And therefore that person is then faced with not only all of the emotional pain involved in having to fight for your children, but with all of the sort of mental pain that happens from someone saying this to you, and then the government taking over and saying the same thing to you. And wouldn't it be a better system and a healthier system if you could just seek support, like Ajita explained, where someone could say to you without bringing in a government system to say, how can we help you, right? How can we provide you help to address what's happening to you? So I think that part of what the problem that has arisen is that we've created a system which essentially is taking, on some level, can be saying the same things to the survivor that have been said to that person, male or female, prior to connecting to the system.
Thank you all for sharing that. Our next question focuses on, when it comes to mental health and mandatory reporting or supporting, what comes up for you all when you're working with the perpetrator or the person who's causing harm? And what considerations do you bring to the therapeutic outcomes when working with perpetrators? And I do appreciate the comment that was mentioned by Stacy, highlighting that this behavior is frequently bidirectional. So feel free to comment on that as well.
What comes up with the mental health and mandatory reporting, working with perpetrators? Here's what I know. Hurt people hurt people. Hurt people hurt people. And I'm going to share a quick story about how we got to where we are and the work that we do with Project Fatherhood, just working with our dads. There's a story, there's a building in New York, a 42-story building, and on the 42nd floor, there's a crack. And over time, that crack continues to get larger and larger and larger. So the property manager said, hey, let's get this engineer here to figure out what's going on with this crack. So the property manager called the engineer, said he'll be out the very next day in the morning. So property manager arrives in the morning, the security guy said, hey, the engineer is here. So the property manager goes up to the 42nd floor where the crack is. So he gets up to the 42nd floor and he says, hey, the engineer is not here. He said, no, the engineer went down to the basement. And the property manager said, why is the engineer down in the basement? The crack is up here on the 42nd floor. So he rides the elevator down, takes a step to go down into the basement. And he said, hey, why are you down here, Mr. Engineer? Engineer said, yeah, your crack is on the 42nd floor, but your problem is down here in the basement. What we do with our dads, we have to walk our dads down these flights of stairs to help them understand how they got to where they are in terms of some of their family history and being able to pull back some of those layers. Because what we do, a lot of times, dads are still carrying the trauma that they experienced when they were kids that never got addressed to adulthood. So they're never fully engaged with their kids because no one's ever had an opportunity, or they've never had an opportunity to pull back those layers and get the treatment and support that they need. So it's not that you're a bad dad. It's been something that you've seen all your life. No one has said it's not bad and not good, but you just continue to do it. And what we do with Project Fatherhood and being able to take our dads through these different topics, having these conversations, and creating a space for men. You have to create a space that's safe and secure if you want to get to the root cause of what's going on. But we're not passing judgment on our dads. We're not saying this, we're not saying that. We are allowing our fathers and men to begin to pull back those layers. Then have those conversations with their sons about what's appropriate and not appropriate. Telling our daughters, when we used to grow up, hitting little girls when you growing up meant that you liked them. No, you're setting your son up and yourself up for domestic violence in the future. It's saying that it's okay to hit if you like someone. No, it's not. So we're having these conversations in these rooms with fathers and men, because boys listen to men and men listen to other men. And the work that we do with 24/7 Dad, our curriculum evidence base, is really giving dads new skills, right? And tools that they need to navigate the system. Teaching dads about communication style, learning your style of communicating, learning your partner's style of communicating, so that you can both be on the same page, or at least in the same book. Right? At least in the same book, right? And then we also talk about putting together rules of engagement. You and your partner, when things are good, put together some rules of engagement. How are we going to communicate with each other? What's appropriate, what's inappropriate? What's safe and what's not safe? When should I walk away and when should I stay? Hey, I'm walking away from this situation, not you, but this situation, because it begins to escalate and it's not appropriate for me to be here at that time. So those are some of the skills that our dads are learning and being able to share with their partners as well, and also beginning to break those cycles and passing something down different to their kids that they were exposed to when it was growing up. One of the things we recently did with Project Fatherhood, we had a study done on the work, the intervention, the curriculum we do 24/7 Dad, and I share with you. It's called the secret sauce. And it really talks about the work that dads are putting in when they have these environments where they feel comfortable enough to really begin to share, take off that Superman cape when you get to the door. Let's find out who you really are. And dads are starting to find out who they really are and what they really like. Right. So that's the work that's been done with our dads and Project Fatherhood, and also on the mental health aspect. There was some unintended positive results from the curriculum and from the being in the groups with Black and brown men, that when dads were in these groups over periods of time, anxiety went down, depression went down, and that overall well-being and mental health improved because they were able to take off those Superman capes and really have an opportunity to begin to share what their experiences is and what they want to do and how to move forward, and begin to add more tools to their tool belts than they had before joining the group.
I'll add to this. So I really appreciate everything that Keith said, and the analogy was great. Again, it's, there's two sides of the coin, right? There is that perpetrator profile that we learn about, the sinister, I think narcissistic was mentioned earlier, the person who just doesn't care about anybody else except themselves, and they believe, they don't just say it, they believe that they are the victims. They believe that their lies are being said about them and that they have done nothing, they were provoked, or whatever it is, right? That's one side of the coin. The other side of the coin is that they might not have had a positive role model in their life. They might have been exposed to domestic violence when they were children, or even in their adulthood. They probably might have been exposed to childhood trauma and childhood violence, in their life. And so at some point when we're working with perpetrators, alleged perpetrators, we really have to check our language, like I just did, and then also, get deeper and really ask these questions of like, tell me about your relationships when you were younger. Who was in your life? What were they like? And really get down to, where are some of these behaviors coming from, and identify, hey, it sounds like a learned behavior. This sounds like this is what you saw when you were younger, when you were in your formative years, when you were learning what relationships are like, and this is what you're doing, and acknowledge that maybe their behavior is not even in their control. Right. And also, like he said, like, create that safe space, but also remember to check your bias, check your countertransference, get consultation, come to these types of trainings, because what's going to happen is you're going to enhance your skills. You're going to enhance your rapport building skills, your empathetic skills, so that you can create that safe space, so that you can work with this person who is the alleged perpetrator non-judgmentally, and then help them shape their behavior so that they have a more positive relationship with their children. It's very easy to say, well, the two people can separate and have a restraining order and do all of this, But all right, let's bring it down to, okay, what's going to happen with their shared children? What's going to happen in all of the other relationships that they're going to have moving forward in their life? And I also want to bring in this the community for transgender people, for different gender couples, non-hetero couples, and I kind of want to put that plug in that sometimes they don't have any other options. Sometimes they only feel safe with each other because they've been through so much in their families, in their communities, and politically and on media. So it's very important that we approach all of our clients in the same manner, whether they are survivors or they're alleged perpetrators. And it's very important that we give them that psychoeducation that this is how your behavior is impacting you. This is how your behavior is impacting somebody you care about. This is how your behavior is impacting children, and do it in a non-judgmental way, non-blaming way, so that they can kind of see it for themselves. They can kind of have that insight, that realization that something needs to change. And I have that. If I need to take power, if I need to take control, let me take control over myself, over my own behaviors, and let me make that change happen for me.
I also wanted to chime in on this one. I think what Ajita and Keith have shared is on point. And so our agency, we're really, we have a history of being survivor-centered. But for the last 2 years, I've been doing some Title IX work with the Claremont colleges. And this really falls under that equity-based work that I've been doing and social change, because, when I started working with the college students, I'm working with the respondents, right? And if you know anything about Title IX, there's a complainant, and then the respondent is the one that's allegedly, has harmed the other person. And so I definitely found myself struggling, when I first started working with those students, because I've spent so much time with survivors and really being, like I said, survivor centered. So I find myself, when I am working with those that have allegedly, caused the harm, really trying to humanize them and understand that they're still a person. I think everything you all shared around lived experiences, and maybe they've never seen a healthy relationship, and so that model behavior might not be there. Although I would say a unique characteristic with this population is a lot of them do come from affluent families. So sometimes I wonder where they are getting these type of behaviors from, but it has been a challenge. And I would even say the student body in general, there's a lot of opposition to respondents receiving services, because they feel like, hey, they're the ones causing harm. Why are they getting any type of supportive services? But my response to those students is always, how are we going to change the culture on the campus if we're not working with the ones that are perpetrating the harms or allegedly perpetrating the harms? So I do think that's a big piece for me, working with this other side of intimate partner violence now, is just really trying to still humanize and know that they're also a person that has lived experiences, and they just might need some more psychoeducation around healthy relationships, boundaries, consent, things like that.
Can I share a thought in my side when it comes to working with, I get a lot of the fathers that they read this report and they're saying so many things about them, and sometimes they feel shame. So they don't know how to accept certain things. So they say, well, it didn't happen this way, but it is happening. So kind of just listening to them and guiding them to get the right help. Like just, we have a case plan now, letting them, supporting them in a way where they even scared to look out for resources. So I kind of help them, provide them, I call for them and I make sure I give them an accurate resource. Sometimes they are, they only speak Spanish. So some of the parents that I have. So, helping them accept certain things and move forward. Let's get the help. Let's do this. Let's do that, to help you, to help your family, to get out of the situation and eventually get the help. So that's what I do, as helping some of the aggressors, as they call, perpetrators, in my facility.
And I just want to add, I've done a lot of work with people who are gang affiliated in domestic violence. And I think all of the other panelists really want to go back to what Keith said, that people come from generations of violence. The public health vision of the universe is that violence is preventable, but it really requires having programs like Project Fatherhood and so forth that are available to people. The homeboy, at the time I was doing my project, 100% of the people in the Batters Intervention Program at Homeboy Industries come from families of violence, right? Were either victimized or witnessed domestic violence. And part of the issue is that there's nowhere, if you're gang affiliated, you're not really going to sit down with people and go, and let me tell you what happened in my childhood and so forth. So these spaces where people can actually express what happened to them and receive support are critical. And if we're going to address domestic violence, we have to address it holistically. We cannot cut out groups of people who need support and need tools. And I do want to say that in my experience, the most painful moment for these very, very tough gang affiliated people was when they felt they were losing their children, or that their children were somehow following in their footsteps. And so it's a very personal, painful moment that people don't want to have happen, but often don't have access to the support that they need to overcome some of those things. And as to the bidirectional, and I know we may come back to that, I think it's important not to talk about all violence with one sweep. Domestic violence is about power and control, and it's not bidirectional. It's one direction. And although I feel very strongly about providing services for may cause harm, it doesn't mean that they're not seeking power and control, because they are. And so if someone acts violently, there are different kinds of relationships. There are relationships where both parties are very violent people. There are relationships where someone may become physically violent because they are protecting themselves or they are protecting their children. And there are all sorts of circumstances. So as Shelley said in the chat, it's really important to look at the conduct specifically and in detail. And part of the problem with Child Protective Services is that they are not either trained or given the opportunity to do that. So people end up checking boxes that this person was, did so-and-so hit someone, or did so-and-so do this. And without the larger context, that conduct can often be misinterpreted, and the services offered to those people can often be the incorrect services. So I think it's important to really look at this closely and look at the context and look at the cause before we start talking about bidirectional violence as if that's just a thing, because within this context, it doesn't really exist in that way. And that can be really addressed by some of the things that they talked about in the Pritzker Center project and so forth, education and tools for people to understand that on a deeper level.
Follow up to what Eve said about the check boxes. That's so important. Just looking at a broader context. I've actually had situations where the survivor parent wanted help. They wanted a way out. They want some type of intervention by a social worker to give them that avenue so that they can get out of this relationship. And when we made the report, unfortunately, the boxes weren't checked. And unfortunately, the referral was closed, the investigation was closed. And so that is so discouraging that they're not looking at the whole picture. They're looking at, there was, no one ever hit the person. There was no marks or bruises. No one ever was violent in front of the children. They're looking at those boxes. They're not looking at the broader context of the emotional aspect of it, but the power and control of it. Right. And so I think it's a big drive home message that we have to look at a holistic picture for this family when we are considering what does intimate partner violence look like? What does DV actually look like for this family, not just for what we know, what we've learned about, or what we see in our scenarios that we work with in our trainings. It's what does it look like for this family?
I'm actually hoping to get a better understanding of how you orient your practice when you're working with children who have witnessed or reported domestic violence or intimate partner violence in the home, and thinking about what might be unique when working with children versus working with adults as it comes to mandatory reporting, and if any of this changes based on the child's age.
We have a residential program. It's a DV shelter, and we have two tracks. It's either our emergency track, which is 45 days, or we have a transitional program with 6 to 12 months. So it took me a while to kind of realize that my role within the shelter was unique, just being a male, the only male on the staff. And, you know, it was one of those kind of realizations that a lot of these children may not have ever been around a positive male, and especially being a therapist on site. So that was something that I knew, and it took the team to kind of point that out to me, that, you know, my interactions with them was an intervention in itself. You know, just being around a male that wasn't screaming at them, wasn't harming them or harming their parent. So I think that was something that it made me feel like I would love to see more males getting into, you know, clinical services with the domestic violence population because of that. Because a lot of times, you know, not to say that females are not also perpetrators, but a lot of times it is a male, you know, that's causing the harm. So to have children exposed to a positive male, I think is awesome for them. But, you know, I think it really goes to play therapy. It's amazing, you know, what that does, that children, you know, they're not really going to sit and talk to you like an adult will. But as soon as you pull out Connect 4, Candyland, something like that, they just kind of open up and start sharing. And so how that intersects, you know, with being a mandated reporter, I usually want to know if there's, you know, a history of DCFS involvement with the family, because if it's already historical and it's reported, I'm not going to consult or, you know, call the hotline because it's already been addressed. But I think that's always the challenge, is like using that discretion of like, okay, does the hotline or does the department already know about this, or is this a new disclosure? Because, you know, again, trying to reduce the level of DCFS intervention, I know that's a goal of mine. And I think sometimes that goes a little counterintuitive to the way we're trained, you know, that you need to consult and report. But, you know, just seeing the harm that it can cause, that's always my kind of back and forth is this historical and is it already documented? And do I really need to call this in? Or is this, you know, a chance for this child to kind of process what they've been exposed to? So that's some insight there that I've seen just working in a residential program with DV survivors.
Frequently, when we work with kids, we find that they somehow feel responsible for keeping the peace at home. And sometimes they feel responsible for causing the conflict. When they make disclosures, they also, you know, feel like, hey, I made it worse by telling my counselor. I shouldn't have said anything. I should have kept my mouth shut. It wasn't that bad. And now I can't see my parent. Now I can't live with my siblings. Now I'm going to be taken away. Right. So there's that fear that even children have. And I find that kids who are exposed to violence are much more mature than even me at my age. You know, I see these kids, I hear from them, I think, wow, like that's a lot of emotional maturity over here. Right. So one of the things that's important is kind of setting that tone that, hey, not only are you not at fault for the conflict that's happening, you're not at fault for disclosing anything. In fact, you did the right thing. And now it's up to the adults around you to kind of take over. You're not responsible for keeping anybody safe. And as a clinician who has rapport with children, it's very important to drive that message home that you didn't trigger the report. The report was triggered by something that I heard. And, you know, even though, yes, we are mandated reporters, when we see that this child is in danger, we have to report it, but also sit down and explain this to them, that here are the facts that I heard, and here's what my responsibility is. And I would like your permission to actually make this report. You do what you have to do, but in that session, tell this child and ask this child, can I get your permission? What's going to happen when I make this report? You know, tell me about if they say no, you don't have permission. Okay, tell me more about this no. Where is this no coming from? Get that, you know, ask more clarifying questions about it. Because in that moment, the moment that, and that goes for adults too, you know, the moment that the survivor has made that disclosure, or even when the perpetrator has made the disclosure, you know that you've built enough rapport with them that you can dig a little deeper and ask more clarifying questions. So use that opportunity. And especially very important for children, because they, all of a sudden they're, hopefully the goal is to help them feel less responsible for everybody else, and more safer within themselves.
A lot of our dads, even though we don't work directly with the children, we work directly with the fathers and the dads, right? But we see those behaviors in the dads that the children are experiencing. That makes sense. So what we do with our dads, our staff models the behavior that we want our dads to display with their children. We have monthly activities where we bring our fathers and our kids. Even though we're father focused, we are family friendly. So we invite everyone to some of the events so that dads can begin to practice the tools and the skills that they learn from participating in the group, and still having staff around to give them a little nudge and try it. Oh, it's not, try it this way. Try it this way. It's okay to do it this way. Try something different, right? Because what happens is, over time, we see things that happen. Our grandfather did to his wife. Our dad did to his wife, and I'm doing it to my wife or my kids, and we're not sure why we're doing it. But back in the days, we used to beat in the Black community. The belt was always something to control the kids so they don't get out of line, or someone else doesn't come in and do something harmful. Dad did the same thing. Same thing. Now the dad said, "Why are you doing it now?" He said, "Well, because my granddaddy did it, my daddy did it, so it's supposed to work like this. I turned out okay." I said, "Did you really turn out okay? That you are now beating your kid with a belt when you could have what? Discipline." We talk about discipline and punishment. What does that look like, right? So we tell dads, hey, there's certain ways you can do things, right? You got to be able to take a look at those different strategies and different things that you can do to support your kids, yourself, and your family. So we always want to model the behaviors, right? So, and then we ended up having to report it because the dad was talking about the belt, but he understood there was something different he could do now that doesn't have to go to that different level. And once again, how do we begin to shift that paradigm, break the cycle, and really being able to do something more with our families and our kids and for ourselves? So dads are beginning to working on themselves now to move things different forward, move things better. Thank you.
Going back to Ajita, when it came to my kids, now my son's 19 and I have a 14, 13-year-old and an 8-year-old. I have 4 boys. When this was happening to us, my kids will come to me saying, "Mom, did I say what I wasn't supposed to? Is that the reason why we're now in the shelter? What's happening?" So for me to make my kids feel safe, letting them know, okay, now this is going to be happening. We're safe. It's not because of what you said. It has nothing to do with that. Kind of addressing it in a different way, making it feel like, yes, we're in this situation, but we're getting the help we need because of what, certain things that when I made the phone call to the cops. So just kind of explain to my kids the situation. It's not their fault, because my kids, they felt that it was their fault why we had to leave our home. So for them, it was such a big impact. I'm sorry, taking them away from their home to a shelter to keep my kids was a big thing for them emotionally. So that's something that my kids have. I'm so sorry, but it's just my kids were affected deeply with that.
Thank you, Jacqueline. I just want to add, it would be wonderful, as Ajita said, if this was really a system where people could say, "Could I have your permission to report?" But we don't live in a system that you can give permission or deny permission, and that's part of the problem. So the person with the skill to be able, and the training to be able to make a determination of what's best for this human being is forced into a system where they're not really allowed to give that power to the person receiving services. And that interferes with the ability to provide service. And so it's a wonderful concept to be able to give that power to somebody who doesn't have that power. But it requires us to change the system.
Thank you all. I really appreciate that. And especially Jackie for sharing your experience and your children's experience. It's really powerful and meaningful for all of us to hear from someone who has lived this. Just keeping an eye on the time, I want to make sure we have a chance to touch on at least one audience question. So I thought it might be helpful to focus on some other resources that might be another option. This exact question is, we're all trained to entrust CPS with activating or with needing resources to protect children. If not using a mandated report, what other resources could have been activated if there are concerns that direct abuse is taking place? I think the question is trying to get at, if we're saying mandated reporting isn't helpful a lot of times, what other resources can we rely on to make sure that our children and families are safe and getting the help that they need?
I think you can refer them to all the people on this call. I mean, I think the idea is, there's a federal law that talks about strengthening community pathways, they're called. And the reality is we have insufficient, but we have services and we have these wonderful projects like Project Fatherhood. We have wonderful people who can offer therapy and so forth. So the answer, again, Child Protective Service is not a direct service agency. It's an administrative agency and arguably a punitive agency. But the reality is we really need to have systems that are developed that funnel people or send people to supportive services, and we need to have resources for supportive services to be able to expand their services so that within our communities, people can receive culturally appropriate services, services from people who understand their lives and where they're coming from and the pressures they're dealing and so forth. So I think we have the beginnings of a system, but we really need to focus our efforts on strengthening the resources to develop community pathways to help people address these issues.
I just want to clarify that I'm afraid of generalizing that mandated reporting is never helpful or is not helpful in any TV situation. There are certain situations where a child welfare call must be made because a child's life is in danger. A child is their safety is at risk, right? So the call must be made. And again, I'll say it again, there are helpful things that DCFS can do. But I think really the drive home message is that that communication is important. So communicate with the client and get as much information as you can and communicate that back to child welfare. So it's not just, hey, child witnessed something, I don't know, you figure it out, right? The other part is that it is our responsibility as service providers to educate ourselves on all the different trainings and resources that we can utilize while we're supporting this client, right? So there are trainings through Pritzker and UCLA Center. There are trainings through DMH. There are lots of trainings that a lot of the agencies offer. We heard quite a few of them from like Project Fatherhood and everything. Educate yourself. Like what is there's a decision tree offered by the training for the Assembly Bill 2085. There's plan of self-care documents that you can fill out. So there are a lot of tools and resources that are available to people in direct contact with our clients, with families who are going through IPV. And so utilize those and then use those as a guide to help you decide, like, is this child at risk? Do I need to make this report? And of course, use the consultation, use colleagues, and you can call the hotline for consultation, but make it very clear that this is a consultation call. I don't know if there's abuse. I don't think there's abuse, or there was some mention of like fighting happening and yelling and screaming happening, but I don't have any information on that. So be very clear on the facts that have been given to you, provided to you by the family, so that we can make sure that, you know, the families who need DCFS support can get through, and that we, and again, it's our responsibility as clinicians to give them that holistic picture.
And I think it's important for us to begin to work horizontal versus vertical. So those agencies that have a history of separating families, we need to work just as hard at finding ways to keep families together and bring people to the table who can make that happen, right? So how do we keep these families together? And we know statistically that children are better off when they have both parents in their life and are engaged by both parents. And having those organizations support what those families need is really crucial. And one example was one of our dads, we had an event, father-daughter tea, but the dad did not have, he needed supervised visits, so he didn't have someone. So we contacted the social worker. She knew the work that we was doing. She agreed to support, and she actually came with the daughter to the father-daughter tea to support the event so that the dad and the daughter could spend that time together. That's working together, and that's what we need to continue to do. Talk to each other, figure out what works best for the kids and how we can make things happen, and rather than making it so difficult for people to come together and do the work.
And I'll just add to that, collaborative care, you know, working beyond silos. I think that is the answer to that question. So glad everyone spoke to that.
Thank you all so much for being here. I know we're past time, so I just want to thank you all again. We appreciate any feedback or questions. Brittany's going to post the Google form in the chat. Again, please follow us on social media, UCLA Pritzker, or visit our website at www.pritzkercenter.ucla.edu. Again, thank you all for being here. It's really been a pleasure.
Thank you so much, speakers. And we'll email you with any further questions that audience members have for us. And audience members, we will be emailing out a little resource form with some links there. Thank you so much.